Here at Newcastle Hospital Trust, we're proud of our passionate and skilled nursing teams across the Medicine Directorate, and particularly here at the Freeman Hospital, where the majority of our older people's wards are. Our teams are renowned for their expertise in managing the most complex and frail patients. So as a nurse coming to work in medicine at Newcastle Hospitals, we can give you a unique and comprehensive range of training, skills and development to help you become the nurse that can deliver both acute care and develop your own career working with us. So whether you're a student just starting your career or a more experienced nurse, we would like you to bring your passion and your skills to help us meet the needs of the growing older population who need the specialist and acute care that we pride ourselves on delivering here at Newcastle Hospital.
Hello, my name's Carol Gillespie. I'm clinical educator for older people's medicine here at the Freeman Hospital. So there are 3 clinical educators within the directorate, and we all work as one team, and we aim to support and develop all new members of staff working within the directorate. Any new member of staff are given an introduction pack which guides them around the who's who and what's what basically of the medicine directorate. So as a group of clinical educators, we've developed a 3-day development programme, and this gives our staff both the theory and practical side of any clinical skills that they need to have. And this is very, very unique to the medical directorate. The development programme has been evaluated very, very well, the managers and the new staff, and also included in that are the old members of staff, the staff that have been here for a long time. They now have knowledge and skills that have been updated. On the success of this development programme, we've then decided to develop a 4th day, and this is going to be around older people's medicine, so obviously things like dementia, delirium, medication, falls, that sort of thing. So that's a future plan. So as clinical educators, it's an integral part of our role to support and develop our staff. So once you've gone through your hopefully 4 development study days, then you will hopefully then go on and actually complete this by doing a coaching, mentoring and development day about yourself as well. Thank you.
Hello, I'm Charlotte, staff nurse on the stroke unit where I started my career 3 years ago. I've developed a wide range of clinical and nursing skills in patients with stroke and acute complex medical conditions. Acute medical wards are a fast-paced environment which can be challenging. However, this has given me the opportunity to develop my skills in the time management, prioritisation, communication and with patients and families, as well as recognising and acting upon a deteriorating patient. Within the medical directorate, we are encouraged to progress and attend outside courses and development programmes to enhance our learning. This has enabled me to become a link nurse in tissue viability, where I attend regular updates and cascade this knowledge back to the team with the aim of improving patient safety and reducing hospital-acquired pressure damage. Working on 41 has given me the confidence to manage the ward and team on nights and weekends, and I am now looking forward to a new challenge and progressing further in my role in the emergency department.
Hello, my name is Lisa Guthrie and I'm the matron for the medical wards and departments at Newcastle upon Tyne Hospital's NHS Trust. In general medicine we have a number of opportunities for newly qualified staff nurses. So we have the assessment suite and the emergency department within general medicine. We also have a wide variety of subspecialties which may interest you as a newly qualified staff nurse. So we have extensive older people's medicine services. We have a number of subspecialties where you could gain experience, including endocrinology, diabetes, respiratory medicine, pharmacology. We have the hyperacute stroke unit. We have gastroenterology, hepatology. We have tropical medicine and infectious diseases, and immunology and allergy, and falls and syncope. In general medicine, you can expect to be well supported as a newly qualified staff nurse by the matrons, the ward sisters and charge nurses. In each of our wards we have a band 7 and 2 band 6s, so there is plenty of visible leadership around in our wards and departments. In all of our wards and departments we have opportunities for staff to develop their careers. We allow staff to be flexible within the service, and we support people to do internal transfers. So, for instance, if you were appointed into the stroke ward and then wished to develop experience in infectious diseases, we would support you with an internal transfer with the view that it would develop your career. As a newly qualified staff nurse in general medicine, you would have access to bespoke training to support you in your new career. As you developed in your career as a band 5, you would have access to leadership training, and if you progressed onto a band 6 post, you would have a specific development programme targeted for that role. And as you progressed further into a band 7 or a specialist role, you would also have access to supported training within medicine and within the trust as a whole. So if you would like to start your career with us in general medicine and would like to visit us, please don't hesitate to contact me either via the hospital switchboard or via email. Thank you.
Hello, my name's Melanie Gilbert. I'm a senior sister on Ward 14 at the Freeman, which is an orthopaedic rehab ward within the Medicine Directorate and specifically within older people's medicine. Working within older people's medicine, I've worked on these wards for about 9 years now, since I came over from Newcastle General, and I think many people's opinion of them is that there's not much to it, and older people's medicine's quite dull and uninteresting, but actually it's very varied, and there's lots of skills you can develop while you're on older people's medicine. It's an excellent place to start your qualified nurse role, and you can consolidate everything you've learned as a student on these wards, developing your management skills a little bit further, understanding the complexities of older people and all of the social and psychological aspects that come, as well as the complex medical issues that they all come to us with. Within our wards, it's like a nice little community. All of the wards work quite closely together, and there is the availability for you to rotate to different wards, so you get different experiences. Like I said, I work on orthopaedic rehab, but there's acute medicine wards. There's Cherryburn, which will be moving over to the Freeman very soon, and that is stroke rehab. And there's lots of different skills you can learn from all of those wards. So you're not just pinned to one ward. We're quite flexible, we're quite open, and we're happy to try and support people with their development. There is a new development programme within the Directorate, and also once you get a little bit more experienced in your staff nurse role, there is the leadership programme, which we're quite supportive of getting staff onto, so that we can go with succession planning. But we have a lot of in-house training available now, which we didn't used to have, but we've developed this really substantial programme, and we're keen for all of our staff, qualified and unqualified, to develop their skills and knowledge around the area of older people. If you're interested in coming to work within older people's medicine, just give any of the sisters a ring or the matron, and we'd be pleased to see you. Happy to show you around the Directorate and the wards and give you any advice or support that you need. So come and join our team.
So I'm Sarah, I'm a sister in orthopaedics in medicine at the Freeman. I've been qualified for 5 years now. I chose to come into medicine because of the diverse opportunities it gives, especially for newly qualified nurse. There's lots of different areas to move into and lots of experience to be gained. So I started on Ward 48, which is gastroenterology, and then I moved to infectious diseases, where I spent most of my career, and that was so interesting, and the things that I got to see and do, I'll probably never experience anywhere else again. When I decided to move on in my career, I moved over to Ward 14, where I work now, and again, the opportunities and the encouragement from the staff to move up and to change your job and to do things differently is amazing from everyone involved, really. once I've got here, I had so much support in my new job, my new role, which was fantastic. As part of my job and as part of all of the staff nurses' job on the ward and the healthcares, we get the opportunity to be linked nurses for things that we've got a specialist interest in. So I've had a lot of opportunities through my interest in tissue viability, and the extra courses and study that I get to go on has really enhanced the patient care that I can give, and has given me so much more opportunities in further development, and it's given me a chance to enhance my career opportunities.
Hello, my name is Grace. I'm a staff nurse here in Ward 16. It's a liver and gastro ward as well as a substance misuse ward. So the reason why I came to a medical ward is because I strongly believe that if you want to build a very solid foundation with regards to your nursing skills and knowledge, this is the best ward to go into. Because it's in a daily basis, you get to challenge yourself, that's the biggest perk for me. So you get to handle different cases in a day-to-day basis, and it's very exciting because at some point you get to handle it's an interesting one, which is you haven't really handled before. And with regards to the teamwork of the ward, it's fantastic. You get to meet different kinds of people, different professions, and the best thing about this is that your opinions or suggestions with regards to the patient management is valued in the sense that when you do a huddle, just a bit of a brainstorming what's best for the patient, they do lend an ear to you and definitely value your opinion. There's physiotherapists you speak to with regards to the mobility, OT, social workers, obviously the medical team, and with all your colleagues as well.
My name's Amy, I'm the junior sister on Ward 15 at the Freeman Hospital. I first came into medicine because it gives you such a wide knowledge base. You encounter all of the different long-term conditions. It gives you a bit of experience and knowledge in everything, so you're not an expert in one thing. I love working in older people medicine. Ideally you get to discharge them from hospital. The social care aspect of it is vast. You'd need to do multiple assessments, and I'm very passionate and I love what I do. I love delivering high quality person-centred care.
Hi, I'm Gillian Cramin. I'm a dementia specialist nurse. My job is working at the Melville Memory Clinic and working on the acute medical wards for older people. I love my job because I get to meet lots of amazing people in all different stages of their dementia illness and the journey that they're going through. I've nothing but worked with older people my whole career and can totally recommend it. They bring so much joy and fulfilment to your role as a nurse.